Welcome to our LIS6271 research proposal group presentation, Growing Together Intergenerational Community Gardening at the Public Library group presentation done by Charlie Cantley, Michelle Canning, Fatima Koblia, and Eleanor Forney.
Everyone deserves to have access to healthy foods. Unfortunately, fresh produce is one area many can't afford at the grocery store. According to Feeding America, over 5 million seniors and 13 million children were food insecure in 2021, and the CDC reports that approximately 20% of American children ages 2 to 19 are obese or have a BMI at or above the 95th percentile. Therefore, communities are looking for ways to give their citizens access to fresh produce. One such way is through community gardens. Community gardens give fresh produce to the gardeners as well as the community. The goal of this research study is to see how we can implement a community garden at our local library to meet the needs of all ages in our community. Researchers such as Berg et al. 2023 and Chauvenet et al. 2021 have found that gardens can provide positive health benefits such as weight loss, improved mental health, greater bone mineral density, more physical activity, and better cognitive function through participation in a community garden.
Community gardens are ways to connect with nature, but they're also an opportunity for people of all backgrounds, ages, and cultural identities to come together as a community. Ruby et al. 2007 cites the community gardens in her New York City neighborhood to show how the community benefited from growing food, bringing people together, and utilizing space that was previously not in use. For young children especially, contributing to the family's food supply by growing food with their grandparents was said to give both purpose and motivation to a child's gardening knowledge.
Furthermore, into our lit review, we studied Davis and Brand in their 2017 study of instructional gardening programs. These were for particularly school-age children ages from 5 to 10. They found a very positive impact on lifelong eating habits and that lead to decreasing in childhood obesity when kids are exposed formally to instructional gardening programs. Their benefits can be broken down into two categories. The first one being nutritional benefits, a quote saying, "Gardens provide healthy food for consumption at the child care facility, increased exposure to willingness to try fruits and vegetables among the children, increased knowledge of the food and where it comes from, and encouraging physical activity." And then the second category, non-nutritional benefits, includes gardens encouraging a connection to the natural environment, providing enjoyment for children, incorporating gardening activities into other areas of learning, teaching responsibility, and sharing the gardening experience with the families of the children. So as you can see, school-age programs that include gardening outside are a great way to help decrease childhood obesity, as studied by Davis and Brand in 2017.
For Growing Together, our aim is clear: to establish a community garden at Sunshine Library that unites generations while yielding fresh produce. This initiative promises educational, social, and nutritional benefits for our community. With a defined goal, survey strategy, budget outline, and timeline in place, we're ready to implement this project effectively. Through research surveys, interviews, and community engagement, we're currently assessing interest and identifying potential barriers to participation. Our objective is to customize the garden to meet diverse nutritional needs and social preferences, nurturing healthier lifestyles and stronger community bonds. By integrating gardening into local education and wellness programs, we seek to empower residents to make informed food choices, fostering resilience within our community. This initiative not only tackles the immediate food access challenges, but also champions sustainable, community-driven solutions for long-term health and well-being in the Sunshine community. We have the budget and timeline. So our budget is just under $20,000, and we'll have 4 employees working on the garden. 1 will be a full-time librarian and 3 will be part-time library staff, and they'll take turns rotating shifts working on the garden. So the full scope of our timeline is May 6, 2024 to May 30th, 2025. And most of 2024 will be getting the project off the ground, doing the proposal, getting the budget approved, and getting those preliminary research surveys in. And then in November, we'll get started on getting staff trained on the community garden. So it'll be officially launched on January 13th, 2025, and then it'll end on May 19th with some time afterwards to collect and finalize the data and create visualizations, and that will be presented on May 30th.
For our research design, we'll be utilizing mixed methods to gather information and data before and after the program is implemented with a survey and then an interview. Your survey will be conducted prior to the start of the project and will gather information on our community's demographics, as well as their interest and opinions about starting a community garden, as well as what barriers might exist to their participation in that garden. Survey questions will be formatted as a combination of Likert scale and write-in responses, and the data collected through the survey will be used to determine the most viable courses of action for the creation of the garden and to help inform the policies put in place for the garden's use. The survey will be advertised through the Sunshine State Library's newsletter and promoted during library events. In order to reach portions of our service area that may not visit the library regularly, the survey will also be advertised at various locations in the community through our partners, including at community centers, schools, local businesses, and the like. At the conclusion of the program, we will conduct an open-ended qualitative interview, or interviews, with the children and their guardians. The main thing we hope to learn is if participation in the program has resulted in any changes to the family's nutritional practices and needs. We also hope to learn if participating in the garden has impacted the children in terms of their social habits, intergenerational relationships, and health.